Psychology helps us to understand human behavior, but it also involves applying what we have learned to help people, to help organizations, and just help to communities to function better. The most common and widely known application of psychological science is the clinical practice of psychology, which refers to the diagnosis and treatment of mental disorders. Now, in order to better understand why people do the things they do, why they behave or misbehave, one thing that we tend to do nowadays is look at the brain itself. We have a common phrase that we like to say nowadays that psychology is biology, that, previously thought to be a disconnection between the metaphysical mind and the physical body. We don't see that as a disconnection anymore. The mind and the body are one and the same. So if we treat the body, we can affect the mind. So when it comes to questions about the nature of mental disorders, their causes, and their consequences, we can empirically test treatments and empirically study, what the cause of such disorders might be. Like we know, for example, that Parkinson's disease is due to dopamine malfunctioning in the brain. So there's a malfunctioning of that system in the brain, and it can be treated by, supplying additional dopamine, to put it simply. So, as is the case with any science, though, there's a lot of nonsense out there. As with other questions about human behavior, we can't just rely on what is commonly believed. We can't rely on our gut feelings, our intuition, because it's very easy for those to be biased in some way. The only accurate way to determine if a treatment is effective is to test it. And that definitely applies to clinical psychological science. Just to give you an example, there was a mainstream idea out there, and you might still believe this, that can be seen in dozens of popular books and websites. They all claim that adult children of alcoholics, the children who are raised by alcoholics, have a distinct personality profile. In other words, being raised by an alcoholic affects you in various ways. Like it affects your self-esteem, it affects your feeling of powerlessness, and it affects your ability to be intimate with somebody else. So these individuals have problems in all those areas. And while this might make sense to you, it does seem to make some logical sense, if you survive that kind of an abusive childhood. But we've studied this, and science has demonstrated that adult children of alcoholics are no more likely to have these kinds of problems than anyone else. So just because it makes sense on face value, that doesn't mean that it's real. Well, the only way to verify if this stuff actually can be explained, how it affects a person, is to use the scientific method. So we test treatments. That's one of the big things we do in applied psychology, is just try to see if various kinds of psychotherapies and medical therapies can help an individual. Now, if a psychotherapy, for example, is an effective treatment for depression, then systematic observation should reveal that individuals who are suffering from depression improve. People who receive the psychotherapy have less severe symptoms than when they started, and less severe symptoms than other similarly depressed people who did not get that treatment. So this is just an example of what we would call an empirically supported treatment. And there are a lot of empirically supported treatments out there. It's quite a long list. But these, as I already described, are treatments that show greater improvement in the symptoms than not receiving a treatment, receiving a placebo, a fake treatment, or receiving some other kind of treatment. So empirically supported treatments are ones that do, consistently show greater improvement. And many psychotherapeutic treatments have received strong empirical support. such as cognitive behavior therapy, which has been shown to treat depression, panic disorder, bulimia nervosa, and post-traumatic stress disorder, and exposure therapy, which has been effective at treating post-traumatic stress, behavior therapy, which has been effective at treating depression, behavioral couples therapy, which can effectively treat alcohol and substance abuse disorders, exposure therapy with response prevention can help with obsessive compulsive disorder, and family therapy can help people who are suffering from schizophrenia. But this is just a short list. There's tons of empirically supported stuff out there, and we're always studying new methods to help people. Clinical psychology is advancing all the time.